Hello, Ms. White. My name is Sabrina Dahlgren. I'll be your nurse today. I'll be going with you through your head to toe exam. In total, we should be here about 30 minutes. The first part should take approximately 15. If at any point you're feeling discomfort, you have questions, do please ask or let me know. First thing, I'm going to perform a bit of hand hygiene. While I do this, would you mind giving me your full name and your date of birth? Thank you, name and birth date verified. And I'm also going to clean my stethoscope prior to examining you, since Lord knows how much lint I've collected. We shall see. All right, let's draw the curtain. I believe the therapy cat is well out of the way, but she might wander in. So we're going to start by taking your vital signs. First off, are you in any pain today? All right. Patient reports no pain. Have you had anything to eat or drink in the last 15 minutes? No? All right. Have you smoked in the last 2? No? All right. Perfect. Let me take your temperature. We're going to do this in your mouth, under your tongue. All right. Patient is not febrile. Temperature is 97.2. All right. Next thing, we're going to take your pulse. What I'm going to do is take your pulse at your wrist. I will count it for 30 seconds, and then I will report to you what our finding is. All right. Pulse is 60 beats per minute. I'm going to count your respirations. Just keep breathing just as you are. All right. Respirations are 18 breaths per minute, even and unlabored. And lastly, we're going to take your blood pressure. So let me grab the cuff. So what I'm going to do is first check that I have the right size cuff. So when I check the width of the cuff, it should match approximately 40% of the circumference of your arm. Excellent. And when I wrap it around, the bladder, the part that inflates, should match about 80% of your arm circumference. Perfect. So let's get that positioned approximately an inch above your brachial artery. All right. What I'm going to do is I'm going to place the diaphragm against your brachial artery. I'm going to inflate the cuff until I can no longer hear your brachial pulse. Once that happens, I'm actually going to go up about 30 points past, and then I'm going to slowly release the air from the cuff at about 2 millimeters of mercury per second so that I can get an accurate blood pressure reading. All right? All right. Blood pressure is 110/78, which is in a perfectly acceptable range. Let's put that cuff away. All right, the next stage is going to be our cranial assessment. I'm going to be checking the nerves of your head. I'm also going to be checking some of your head and neck functions. So let us begin. Full name, please. All right, where are you? What time is it? And what's the date? Perfect. Patient is oriented to name, date, time, and location. I'm going to first measure your pupils without messing with the lights. Pupils are at 4. I'm going to dim the light and we are going to check your eyes. Okay, one eye at a time. Excellent. Pupils are even, round, and reactive to light adjustment. If you could please now track my fingers' movements. Thank you. Cranial nerve 2 optic, cranial nerve 3 oculomotor, 4 trochlear, and 6 abducens are all intact. All right, smile for me, frown, raise your eyebrows. Excellent. Facial nerve 7 is also intact. You are conversant and have been well balanced throughout. So cranial nerve 8 vestibulocochlear is also intact. I'm going to check your ears. All right, no lesions or drainage issues with the ears. I'm going to inspect your nostrils and your mouth. I will grab gloves for that. While I'm putting on the gloves, if you could please cover one nostril and inhale and exhale. Excellent. And if you could repeat that on the other side. Good. All right, quick inspection. All right. There are no obstructions in the nose. Now we're going to check your mouth. If you could open wide for me. All right. Top of the tongue, bottom of the tongue, one side, and the other. Excellent. Cheek, cheek, upper palate. Lift your tongue, please. Lower palate. Excellent. And if I could have you stick your tongue out and say, ah. Perfect. Thank you very much. All right. Buccal mucosa is pink and moist. Teeth are in good shape. Tongue is healthy with no lesions. Upper and lower palates are intact. Speech is clear. And the clear pronunciation of ah and back of throat proves central nerve 10 is intact. All right, I'm going to check your trachea. I'll touch your throat. Trachea is midline, and I'm going to check your carotid pulse on both sides. Perfect. Pulse is regular and bilateral 3+. Let's give it a quick listen. I'll be listening to the carotid 3 positions on either side of your neck using the bell. Perfect. Regular pulse, no bruit. All right, to begin the lung and thorax examination, I'm actually going to have you turn around. All right. Thorax expands symmetrically. AP diameter is less than the circumference. And the spine is midline. I'm going to touch your back. All right, skin is warm, dry to the touch, and intact. Okay. even and symmetrical thoracic expansion. I'm going to touch along spots on your back. Let me know if there's any pain. Any pain? Patient denies pain. All right, now I'm going to tap against positions on your back. All right, I'm going to place my hands against your lower back. You're going to feel a wider pressure application. Any tenderness? All right. Patient reports no tenderness in CVA. I'm now going to listen to the breath sounds on the back. All I need you to do is take steady inhales and exhales. I'll move the diaphragm of the stethoscope as you cycle through your breathing, all right? Perfect. Breath sounds are clear bilaterally with no adventitious sounds. If I could have you turn around again, please. All right. Visual inspection. Skin is intact. It is warm and dry. I'm going to pinch just below your clavicle. All right. Excuse me. Skin turgor is elastic. And let's give it a quick listen. Same as before, just continue taking nice, even inhales and exhales. Thank you. Ventral breath sounds are also clear bilaterally with no adventitious sounds. So that will cover the first portion of our head to toe, and we will continue in just a moment.